If your hand is still not working after your stroke, or if you're seeing just little flickers, little teeny bits of movement, but not quite as much movement as you want to see, there can be many reasons that are bringing this on. Okay. And regardless of if your stroke was more recent or if it's been a little time since your stroke happened, there is usually more than one reason that might be bringing this on. So let's touch on what some of those things may be, because I believe understanding the reasons behind what might be going on in your specific situation can make you so much more effective in how you approach your recovery and your routine at home. So, number one, the most obvious overreaching issue after the stroke is just the damage that happened from the stroke itself. So, when a stroke happens, there's damage to the tissues in the brain that disrupt those messages and signals that normally are sent. You know, we think a thought, I want to lift my arm or close my hand. That's a message, and it's initiated in your brain, and then it travels through the nerve to the muscle, and then it happens. And it happens like in a nanosecond. It's so fast, right? You don't even really think about it. But after stroke, you need to think about it, right? It's That's kind of the retraining of the brain piece, okay? And so when those areas are damaged, you have to be so intentional. You really have to kind of tap into another gear to help your body, help your brain, help your nerves reestablish those connections. So, how do you do that, right? A big thing I see a lot is stretching without, I call intention, or like intentional stretching. Yes, you want to stretch your hand and any joint, really. It applies to all of them. But stretching without having that focused attention, meaning I'm extending my fingers, meaning straightening my fingers. You're not just sitting there watching TV and just passively la 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 extending and straightening your fingers, or whatever the movement may be. What you need to do is, in your mind, think intently, like hyper focus on that movement as you're working on the stretches, because that's going to give your brain that opportunity to engage and help kind of reestablish those connections again, from the brain to the nerve to the muscle. So make sure that that is something that you start doing. It's not a very intuitive thing. Like I said, just like you got to find another gear, you really have to be so focused and intentional with every stretch that you're doing, if that's the goal that you're going for, right? You're really trying to help your brain reestablish those connections, right? So think intently. The same kind of theory applies when you do things like visualization. And I did do a video about that. So if that interests you, or if you think that's something you want to throw into your routine, please check that one out. The other one that's very similar using this method is mirror therapy, right? You're using a mirror to kind of trick your brain, but again, you have to be hyper focused on that image. So again, it all kind of taps into the same thing, like you're using your mental capabilities to help your brain, nerves, and muscles reconnect. Okay, so that's a big one, right? So number one was there's damage, right, from the stroke itself. Number two, there's a lot of stretching and things happening after stroke, but we're not harnessing those opportunities to make it intentional to help reestablish those connections. Number three, another thing is muscle tone. And I did do another video talking more specifically about muscle tone versus spasticity and kind of what all that means. But muscle tone in general is very common after stroke. And when excessive or extreme muscle tone kind of sets in, obviously that is definitely going to limit your ability to activate and utilize your hand or any other joint in the body. And I have seen this where people actually do have, active movement, like they actually have muscles firing in the hand, the finger, the wrist, but there is so much tone in there or muscle contracture in there that it cuts them off at the knees. Like it's there, but um, they can't utilize it, and that can be really frustrating. So understanding tone, spasticity and all the different things that go along with managing that is going to be key. So if that is you, please check out that video because there's a lot more to managing tone just in it of itself. But again, that is another thing that can definitely limit your hand function after a stroke. All right. Number 4, being overly focused on grabbing, flexing, pinching, like just closing the hand, which of course is a very functional movement for all humans, right? But a lot of times, and I've said this before, after a stroke, people can become overly focused on just grip, 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 right? So this is going to can affect your hand function over time. If you're focusing on strengthening and increasing movement in an imbalanced way, so you're more working on closing, but you're forgetting and ignoring all of the other muscles that open the fingers, lift the wrists, extend the wrist. It needs to be in a balanced way. So if you're approaching your strength routine in an imbalanced way, you can also limit the amount of function you're going to see in your hand. Okay. Number 5, if you are someone that had a stroke that caused or created what we call like some type of neglect or inattention to your affected side, that is also obviously going to impact and kind of limit your ability to engage with that side of your body, which is going to limit your ability to do some of those intentional things to reconnect, reestablish those connections in that hand. So inattention and neglect can be a huge barrier if that's something that you're dealing with. Okay. Another thing we don't always talk about a lot is sensory changes. So obviously, if you've got funky, weird sensation in that hand, or that hand is numb, it's like it's detached from your body. It's like you don't feel it. You see it, but if you're not looking at it, like you can't really feel it. That's another factor that can influence or impact your hand function and your ability to kind of engage in some of these other techniques, right? And then actually, this is probably a really big one that it's one of the biggest mistakes. I talked about that in another video, like hands down, one of the biggest mistakes people will make and can make after stroke is you just don't use that weaker side, whether it's your arm, hand, leg, whatever. It's just like it doesn't work. You kind of cast it aside and you just kind of go weeks and months like that. So there's a term for it. They call it non-use or learned non-use. Like you just get used to not using it because you just kind of had maybe a different mindset early on, and you kind of fell into that pattern of not using that hand at all. And so again, obviously, if that's kind of where your headspace has been, that is hugely going to impact your function in your hand or your ability to reestablish that function in your hand. You have to use it. And I know a lot of people are like, look, my arm is not working. My hand is not working. Like, what do you want me to do with it? Right? There are so many ways to incorporate and engage that hand and arm. And I've talked about that in other videos as well. Using repetition, using your hand and arm in functional ways, whether you've got active movement or not, it has to be incorporated. Okay. It's all connected. It's all connected. Okay. So what are the big takeaways here? When you're stretching, you need to start utilizing what I call intentional stretching, right? You need to be activating those muscles, whether you are physically able to do so or you're just using visualization or that mental imagery, or you're just mentally so focused as you're stretching that you're thinking as though you're doing it, even if you're not. Okay. That is critical. Intentional stretching, linking activation of those muscles using your mind. Okay. Using weight bearing to break up tone, right? Huge. You've got to kind of engage those limbs, that hand and arm, it's all connected. Stretching intentionally, using weight bearing, using that hand, period. Just using it, even if it's just as a stabilizer. You're putting weight through it while you do something else. All of these things all together are what's going to lead to strengthening and improving and reconnecting those pathways from the brain and the nerves to the muscle. All right. It is so critical that this is kind of where your head is as you're looking at or planning what you're going to do day to day for your recovery. This way of thinking should kind of be the backdrop to everything. Everything needs to be intentional, and with purpose, and really build that muscle up here that's going to hopefully make it easier for you to use some of these other techniques that maybe don't come so naturally and aren't very intuitive. It's going to take lots of practice, but it is so key and so fundamental to getting that recovery back in your hand. Okay. This is, again, so critical, but it can be a lot. And I know as therapists, this is just what we do and talk about all the time. So use these resources, and it doesn't just have to be my videos. There are, I'm sure there's a lot of other resources out there, but please seek the information, like seek what you're looking for. I do have weight bearing videos showing you weight bearing on a ball. You can, like a large physio ball, you can weight bear in standing, you can weight bear against the wall, um, weight bear on all fours, on the bed, on the floor, on a mat table. I mean, there's so many things that you can do. It all is just going to depend on your ability level. But whatever question you have, whatever area you're struggling with, whatever thing you're not so sure about, find the answers. You can reach out to me directly anytime you want, and I will respond. My goal is to respond to every single comment. So I am here to help you. You got OT for free, okay? So, anyway, as always, I hope this was helpful, and I will see y'all next time. If you found this video helpful, don't forget to subscribe for more DIY videos to help you along the way in your stroke recovery. Struggling at home? Have a question? Leave me a comment. I'm here to help.